Hi, this is Joe Walensky talking with speakers who will be at our ConveyUX Seattle in January. And right now I'm having a discussion with Stephanie Seraphina. Hello, Stephanie.
Hi, Joe.
Where are you talking to us from?
I am currently in Redmond, Washington.
All right, well, I'm just across the lake, and so it's nice to be chatting with you. Um, why don't you, I know you have your own UX practice. Why don't you tell us a little bit about that and the nature of the work that you're involved in?
Sure. So let's see. So I've had my own consulting business for the last 8 years now, and my focus has been mostly in medical devices as well as kind of some health and wellness products. And my interest has really been in making really making a difference either for a clinician or a patient when they're working with something that is either life-saving or is going to really improve the quality of their life, is really having very thoughtful and well-designed and iterated products that just make it easy for them and safe for them. And even in some ways, medical devices don't really have a lot of personality and people don't really have personal relationships with them. But sometimes they do. And so, even kind of going above safety and usability and really creating just a great, experience for people. That's really been my interest, focusing on more of the medical side.
Well, I know with you have such a concentration in the medical area that I think that's a special category different from different from UX in that a lot of software and apps that we might design want to do the best possible job that we can in designing it, but ultimately it's not necessarily going to directly affect somebody's health.
Right.
Whereas a lot of the things that you're involved in, things just have to be right and can really affect people. I'm sure that's all, those types of things are always cropping up in your work. There's been any things recently that you might want to share about your work that have kind of been along those lines, or that you've noticed that are unique to working within the medical area?
Yeah. So, and just a little bit of background information. Also, the medical device and kind of the whole healthcare industry has really evolved a lot in the last, I'd say, 10 years in terms of, device manufacturers, hospitals, healthcare systems, really taking a lot more ownership and, putting resources and, people and money, into use safety, usability, and improving experience. And, like when I first started working in this industry, there were very few guidelines for, what I needed to be helping a company to achieve. And there weren't a lot of, regulations where we had to make sure that we had done certain processes and had evidence of things. And really, I think, because of lawsuits and the malpractice industry, in fact, it was brought to Congress probably about 5 years ago. There were a lot of deaths that happened that were preventable, and Congress really started to put a lot of pressure on the FDA to for then the FDA to put pressure on all the manufacturers. So I've really seen, in my industry, I've seen, user experience professionals, human factors engineers, user interface designers, information architects. I've seen our role change a lot from being kind of an optional nice to have to now it's mandatory and it's required. And, the contribution that we bring to companies it's really valuable. And, people really will design kind of their whole engineering process around meeting, use safety objectives and user needs for the product, where before it was kind of just like a nice to have. And if we found something late in development. It just got rolled into the next version, maybe. So yeah, so let's see. So recently, I get to work on, mostly what I work on are products that have a hardware and a software element to them. So that's kind of been, my niche. My master's program was taught in both a mechanical engineering and a psychology department. And so I kind of developed a passion and love for, things that you touch, but also have a user interface of some kind that's driven by software. And, recently I got to work on a project that was really meaningful because it was for a device that is used to treat people that have upper respiratory problems. And, most of us have people in our life, either kids that have had asthma and have problems, or, our parents. My mom has, it's a COPD is what it's called. And it's, where the lungs just are not working effectively. Most of the time it's people that were smokers. And, I partnered with another company, and we did a very large study where, we really try to set it up as if, this was really how the project was going to get rolled out. So some people get training, some people don't. Some people have previous experience with products like this, some people don't. We have patients, we have healthcare workers, and then we also have caregivers, because caregivers are very important in, the treatment of, especially with seniors that, really can't take care of themselves. And so, it was a great project. It was kind of humbling in a lot of ways because I've been doing this for a long time. And anytime you work with a vulnerable population, I had one gentleman that came in, and he was a senior, and he actually was overconfident. He was using a device like this and thought that he was going to have perfect transfer of knowledge. And that can really get people into a lot of trouble and create like a lot of frustration for them if it's not working the way that they expected them, the product to work based on their previous knowledge. And, and this gentleman was on oxygen, and, there was some task where he had to get up and go to a sink and sit back down and do some things. And, it was a very close call for me just to end the session, because he was just having so much anxiety for not being able to do tasks correctly. And in a study like we were doing, we really try to be invisible as much as we can, because if they're at home in their kitchen doing it, by themselves for the very first time, we need to really kind of see what errors and what challenges and difficulties they're going to run into. So, so very important work. And I think part of my motivation in participating in this conference is to share, with the larger UX community, what an opportunity there is right now in the medical device world and healthcare industry for, more user experience professionals to come in and make a contribution.
Well, I think this has been a great preview of the things we'll be talking about at the conference, and I think it'll be really interesting to learn about those best practices and hear it from you directly. So we'll just see you live coming up in a few weeks here in Seattle.
Yeah, great. Yeah, I look forward to it. I'm going to try to bring some examples of some things and try to make it as engaging as I can.
All right, great. Well, thanks a lot, Stephanie.
Okay, great. Thanks a lot, Joe.
Bye bye.